दिस इज सेकंड एंड जो ये डिस्कशन होगा आज के जो होगा दैट विल बी अबाउट द मेंटल फिटनेस ऑफ अ पेशेंट एक्चुअली, and that's very important actually. So let me welcome first our today panelists and speakers. I think everybody knows Dr. Deepali Batra. She's a very nice human being, a very nice doctor as well as psychologist. I know her for quite a long time now, and welcome Dr. Deepali, Dr. Batra. And today we have with us, I think, welcome ma'am.
Thank you so much.
We have today with us Dr. Shubha. She is a breast surgeon. I think a lot of people know her actually. She does not need any introduction. Dr. Saurabh Gupta is here again. He is also a surgical, very senior surgical oncologist with us today. I think he will be singing a song as well. And we have a very interesting who are our real heroes. They are like speakers. They are Mini, what I called her. She is very active in this group. And Ritika. They will be talking about their journeys actually. They are the real speakers what we want. They will be telling real world stories. And so बहुत ही important है, मतलब we know cancer treatment, जब भी किसी को डायग्नोस होता है उन पे एक पहाड़ टूट पड़ता है और मरीज को पता ही नहीं क्या करें, उसके परिजनों को नहीं पता क्या करें, तो बहुत ही चुनौतियों का सामना करना पड़ता है और करते भी है, ना कि सिर्फ कैंसर रोगी, ना कि सिर्फ पेशेंट्स, बट उनके परिवार वाले, उनके क्लोज, उनके फैमिलीज, तो और कई प्रकार की परेशानियां हैं, ना कि सिर्फ फिजिकल बट भावनात्मक है और सामाजिक परेशानियां रहती है, व्यवहारिक रहती है, शारीरिक रहती है। जो आज जो हम करेंगे मेंटल हेल्थ के बारे में बात करेंगे और जो हम क्वेश्चन पूछेंगे विशेषज्ञ से, जो हम अपने आप से भी शायद प्रश्न पूछेंगे, पहले पूछेंगे कि कैंसर के मरीजों को मनोवैज्ञानिक सपोर्ट कितना जरूरी है, इससे क्या फायदा है, और अगर काउंसलिंग करनी चाहिए तो कितनी करनी चाहिए, और किसको काउंसलिंग करनी चाहिए, और कौन से स्टेज पर कौन बेस्ट काउंसलर रहता है फैमिली में। और ये देखा गया है कि जैसे हमें पता है कि जितना तनाव हो उतना स्ट्रेस होता है, उतने पेशेंट की क्षमता कम होती है और उतना कैंसर ट्रीटमेंट अच्छा नहीं होता। कैसे की जाए मरीज की काउंसलिंग, ये आज हम डिस्कस करेंगे। नींद संबंधित विषय पर भी हम आज चर्चा करेंगे, और जो मेन है वो जो डिस्कशन है वो है उदासी, निराशा और चिंता की पहचान कैसे की जाए। और मेरे हिसाब से जो मैं समझता हूँ इसको, एक जो मानसिक तनाव रहता है, इसको हम 3 कैटेगरीज में डिवाइड करता हूँ एक्चुअली। एक तो पहला है जब हम डायग्नोस करते हैं, जब डायग्नोस होता है मरीज को तब कैसी काउंसलिंग चाहिए, और दूसरा जो इश्यू है वो हम कहते हैं कि ड्यूरिंग ट्रीटमेंट कैसी काउंसलिंग चाहिए, कि जब ट्रीटमेंट चल रहा होता है, और जो मेन होता है वो पोस्ट ट्रीटमेंट काउंसलिंग, जहां हम मिस करते हैं, शायद जहां हम काफी मरीजों को मिस करते हैं कि हम उनकी काउंसलिंग पे ध्यान नहीं रखते, या एक फैमिली मेंबर्स उनका ध्यान नहीं रखते, या तो वो अपने जॉब में खो जाते हैं, जहां ये सारी चीजें मिस हो जाती हैं। तो आज हम इसी बात पर चर्चा करेंगे। सो पहले जो हमारे स्पीकर है वो डॉक्टर दीपाली बत्रा है। वेलकम मैम, एंड द स्टेज इज ऑल योर्स। एंड प्लीज जो भी मैम से क्वेश्चन पूछने हैं वो आप टाइप कर सकते हो, एंड वी विल बी आस्किंग, आई विल बी मॉडरेटर फॉर दिस क्वेश्चंस टू। Ma'am, please.
Yeah, hi. So can I share the screen?
Yeah, ma'am. You can share.
Yeah, thank you so much. Thank you. Just a second. So, good evening, everybody. Thank you. And this area is really very close to my heart because I've worked a lot in the area of oncology, especially I was at Batra Hospital, and then I used to work a lot in this area. Max, Shalimar, Bagh, maybe I have worked with clients in this particular area. So basically, when we see cancer, it has all mental, emotional, फिजिकल एंड सोनिफिकेशंस। हम यूजुअली देखते हैं कि लोग बहुत तरह की दिक्कतों से गुजरते हैं, और बहुत कॉमन फीलिंग्स हैं. ऑब्वियसली मैं सारी फीलिंग्स के साथ नहीं एम्पैथाइज कर पाऊंगी बिकॉज जो इससे गुजरा है वो इसके पेन को बेस्ट समझता है. बट मैं यूजुअली जितना मैंने देखा है क्लाइंट्स को पेन, सैडनेस, घबराहट की फीलिंग, रेस्टलेसनेस, फियर, एंगर, गिल्ट बहुत कॉमन है. बिल्कुल ठीक कहा डॉक्टर वसीम ने. द मोमेंट डायग्नोसिस होता है वहां से शुरू होकर जो शॉक लगता है, जो डिनायल का फेज आता है, वहां से चलते चलते पूरा ट्रीटमेंट प्रोसेस, ट्रीटमेंट के दौरान जो ट्रीटमेंट होते हुए जो बॉडी में कुछ चेंजेस हो रहे होते हैं उनको सहन करने की क्षमता, उनको लेकर कोपिंग. आपका ट्रीटमेंट पूरा हो गया, अब आपको हर कुछ महीने के बाद इन्वेस्टिगेशन करवाना है. ये पूरा प्रोसेस मल्टीपल फीलिंग्स, मल्टीपल इमोशंस से होकर गुजरता है. मोस्टली मैंने जो कॉमन कंसर्न्स देखे हैं क्लाइंट्स में, पेशेंट्स में जिनको डायग्नोज हुआ है कैंसर, बॉडी इमेज कंसर्न्स बहुत कॉमन है, लाइफ आफ्टर ट्रीटमेंट, एंटिसिपेशन ऑफ डिजीज, सिग्निफिकेंट रिलेशनशिप्स. अभी मेरे पास 2 दिन पहले एक क्लाइंट आई और आई जस्ट गिव यू हर एग्जांपल. सो उनका कुछ ब्रेस्ट सर्जरी हुआ. सो डॉक्टर्स ने उनको क्लियरली ये नहीं कहा कि आपको कैंसर है, बट उनको एक आभास दे दिया कि हो सकता है, तो हम सर्जरी कर लेते हैं. नाउ अब जब वो मेरे पास आई, सो अब उनके इन्वेस्टिगेशंस चल रहे हैं. सो जो उनका ट्रीटिंग टीम है उन्होंने बोला है कि हम और कुछ इन्वेस्टिगेट करते हैं कि कुछ रह तो नहीं गया या कुछ और दिक्कत तो नहीं है. अब जितने टाइम वो इन्वेस्टिगेशंस चल रहे हैं, जितने टाइम उनकी रिपोर्ट्स आनी है, उतना पूरा टाइम शी इज हैविंग पैनिक, शी इज हैविंग फियर. वो सो नहीं पा रही है, उनको डर लग रहा है, जबकि उनका ट्रीटिंग टीम उनको अच्छे से रीअश्योर कर रहा है कि जो भी आएगा हम हैंडल करेंगे, जो भी आएगा हम कोशिश करेंगे पूरी तरह से, और ट्रीटमेंट्स अवेलेबल हैं. उनको उनको बहुत पैनिक, इस लेवल पे पैनिक हो रहा है कि वो अपने बेडरूम में नहीं सो रही हैं, वो सोफे पर सो रही हैं, क्योंकि उनको अपने बेडरूम में बहुत बंद बंद सा लग रहा है. सो उस कमरे में सो रही हैं जहाँ पे बहुत बड़ी विंडो है, because she wants to breathe, she wants to see the sunlight. So I've seen that बहुत बार एंटिसिपेशन जो है कि कहीं मुझे तो नहीं हो गया फिर क्या होगा. दिस होल क्वेश्चनिंग जो हमारे माइंड में कॉन्स्टेंटली चलता है, ये है जो फियर बहुत ज्यादा जनरेट करता है. अपनी सिग्निफिकेंट रिलेशनशिप्स को लेकर होना, अपने चाइल्ड को लेकर, अपने पार्टनर को लेकर, अपने पेरेंट्स को लेकर, काफी बार क्लाइंट्स में मैं देखती हूँ गिल्ट आ जाता है. काफी बार उनको बहुत सपोर्ट की, बहुत केयर की जरूरत होती है, बहुत रीअश्योरेंस की जरूरत होती है. बहुत बार वो अपनी फैमिली पर ध्यान नहीं दे पाते हैं, ऑब्वियसली बिकॉज उनका माइंड और बॉडी कॉपरेट नहीं कर रहा होता है. सो सिग्निफिकेंट रिलेशनशिप्स पर भी बहुत इम्पैक्ट आता है. जब हम फॉलो अप एंड रिकरेंस की बात करते हैं, तो काफी बार जब ट्रीटमेंट पूरा हो जाता है तो काफी पेशेंट्स को ऐसा लगता है कि हेल्थ केयर सिस्टम से छूट गए वो, जब वो हॉस्पिटल में नहीं होते, डॉक्टर के चैम्बर के बाहर बैठे हैं, तो उनका एंजाइटी थोड़ा सा काम डाउन हो जाता है, बिकॉज दे स्टार्ट फीलिंग दैट आई एम अराउंड माई डॉक्टर, डॉक्टर विल हैंडल. सो देयर आर एप्रीहेंशंस रिगार्डिंग रिकरेंस. काफी लोग डर से भी फॉलो अप नहीं करवाते हैं, उनको लगता है डॉक्टर के पास गए कुछ नया आ गया तो. सो बहुत लोग एंजाइटी की वजह से अपने फॉलो अप्स को भी पोस्टपोन करते हैं. काफी क्लाइंट्स में हम एक चीज देखते हैं, एंजाइटी, डिप्रेशन, काफी लोग राइट टाइम पर, बिकॉज अवेयरनेस नहीं होती है, सपोर्ट और ट्रीटमेंट सीख नहीं करते हैं. नाउ एक तो जैसे मैंने अभी कहा, इमोशनल ट्रॉमा ऑफ द इनिशियल डायग्नोसिस एग्जिस्ट करता है. इंडिविजुअल्स में अगेन हैव फियर्स ऑफ व्हाट इज टू कम, ट्रीटमेंट्स, लाइफ डिसरप्शन, जस्ट एक फीलिंग मैं बीमार हूँ, एक कांस्टेंट सिकनेस का फीलिंग रहता है, जो मुझे लगता है काफी बार बहुत साइकोलॉजिकल भी होता है. एक्सपेक्टेशंस दैट वंस ट्रेजेक्टरी इज डिक्लाइन एंड डेथ. एक हमारा एक एजम्पशन बन जाता है हमारे माइंड में कि अब क्योंकि ये एक डायग्नोसिस हो गया है तो यहाँ पे, ये एक एजम्पशन, एक सोच हम बना लेते हैं. और अगर मैं अभी एक क्वेश्चन पूछूं बिफोर आई प्रोसीड फर्दर, तो मेरा एक क्वेश्चन है यहाँ पे काफी लोगों से जो क्लाइंट्स हैं, पेशेंट्स हैं, कि आप मुझे थोड़ा सा एक्सप्लेन करिए कि ओपिनियन में और फैक्ट में क्या डिफरेंस होता है. मुझे पता है आपको पता है, बट स्टिल आई वुड वांट इफ यू कुड अनम्यूट योरसेल्फ एंड टेल मी ओपिनियन में और फैक्ट में क्या डिफरेंस होता है. एनीवन? Can you unmute yourself?
I'm sorry, Dr. Deepali, Batra. I think, can you just come again? I'm Harpreet here from Mohali. I'm sorry, I think I was a little lost in something else. Can you just, opinion from the doctor and the fact that the
No,
patient is going through?
no.
Sorry.
I'm in general asking in life, what is the difference between opinion and fact?
Okay. So fact is like as a state of fact, it is the truth. It is the absolute truth which one is going through, or the fact that is happening. According to me, this is my opinion. Opinion is किसी की सोच about that fact. जो fact है, हर एक की perception, सोच उसके बारे में अलग-अलग हो सकती है.
Exactly. So a lot of times, like I said in this statement, that the patient starts feeling that from now, because the diagnosis is there, I've been diagnosed with this X disease. So now the fate is that there'll be a decline and death. And I want to say that this is only an opinion. This is not a fact. But what happens is that most of the people keep repeating it in their mind. When they keep repeating it in their mind, it becomes their reality. They start perceiving everything every time in the same manner. Now, also then there is an anxiety. Would my friends and family provide support once again? So when I was diagnosed first time, everybody was around me. Now when it has happened second time, or suppose if it happens, will they be there? So there are a lot of questions that keep coming up, which give rise to fear. Now, hopes for future may evaporate. Now, when we talk about the coping skills, we usually convey to people, though it is really, really tough, I understand, but then we convey to people that, try to engage in some creative work, take care of pets, plant, acknowledge efforts of each other, enhance social support, reach out. Though one may not have the energy, one may not want to do it, one may feel that, people would not understand. We start assuming and we withdraw and we stay back. Diary writing. So there are a lot of things that really help in coping of a person. Obviously, we all understand that, doctors keep telling us that work on the physical activities part and maintain sleep hygiene and get back to meaningful work and do some recreational activity. One very important aspect that I always want to work on the clients is my thought, feeling, and behavior. So we need to understand that our thinking leads to feeling, and feeling leads to behavior. The more we ruminate about anything, किसी भी चीज को लेके जब हम बहुत ज्यादा सोचते हैं, ये हो गया तो ऐसे हो गया तो ये नहीं हुआ तो, उससे हमारा मन खराब होता है, हमें घबराहट होती है, और उससे होता है ये कि कुछ भी करने का मोटिवेशन, एनर्जी कम हो जाता है. Like a lot of times when I used to work with the clients, the oncologist would say that उनको कैंसर कुछ और है पर उनके सिम्टम कहीं और आ रहे हैं, कुछ और तरह के हैं जो हमें साइकोलॉजिकल ज्यादा लगते हैं. And when we used to work with the clients, we used to see that there are symptoms of, anxiety, and because anxiety represents in physical symptoms, and the reason is a lot of times psychological. So जितना हम ruminate करते हैं, ये नहीं हुआ तो ऐसे हो गया तो अब कुछ नहीं होगा, अब कोई hope नहीं है, I don't look good, whatever. जितना भी ये thoughts आते हैं, ये हमारे मन को खराब करते हैं, क्योंकि हमें ये एक suppose एक situation है. There are a lot of situations that happen in our life. Suppose I go for an interview and I don't clear an interview. मेरा interview clear नहीं हुआ. अब इस situation को देखने का एक नजरिया तो ये है कि I am a failure. मेरा कुछ हो ही नहीं सकता. मैं कहीं कुछ नहीं होगा, And एक नजरिया ये है that there are many other interviews left. I can try. Usually एक situation है where जहाँ पे एक diagnosis हुआ है, हम एक process से जा रहे हैं, जो disappointing definitely है. बट बहुत बार लोग उस एक प्रोसेस को एक ऐसे नजरिए से देखते हैं जो नजरिया अनहेल्पफुल है. सो देयर आर हेल्पफुल थॉट्स एंड देयर आर अनहेल्पफुल थॉट्स. अनहेल्पफुल थॉट्स हमारी एनर्जी को कम करते हैं. मैं जितना अपने आप को सपोज ये बोलूंगी, जो ये नेगेटिव थॉट्स आप अभी स्क्रीन पर देख रहे हैं, आई एम अ वर्थलेस पर्सन, आई कांट डू एनीथिंग प्रॉपर्ली, आई एम सो टायर्ड ऑल द टाइम, I can't enjoy anything, I'm no more attractive, life has ended, no one is happy with me, I can't cope with problems. जितना हम इन थॉट्स, ये अनहेल्पफुल थॉट्स हैं, जितना मैं इन थॉट्स को रिपीट करूंगी उतना मेरा नेगेटिव इमोशन बढ़ेगा. There is a very famous quote by Viktor E. Frankl. I really love this quote. He said, pain is inevitable, suffering is optional. I have a pain on my shoulder. It's a true pain. Sach ka dard hai. How it becomes a suffering? when I start saying that I should die, my right hand will never work. It's unbearable to see it like that. My pain will increase further 30 to 40%. So yes, there is an emotional pain which exists. Yes, I am not okay because something has happened. A diagnosis is there. I'm going through a tough treatment process. But how it becomes worse when I say that life has ended, nobody loves me, my family is suffering because of me, I'm a burden, and a lot of such thoughts. With such thoughts, the suffering actually increases. So we have to see what kind of thoughts we have. Ideally, all of us should do journaling. We should pen down our thoughts and we should see the pattern of thoughts. कि जो thoughts मुझे आ रहे हैं, वो thoughts helpful thoughts है या वो unhelpful thoughts है. अगर वो unhelpful thoughts है, तो मेरे लिए important है कि मैं उनको helpful thoughts में चेंज करने की, रीफ्रेम करने की कोशिश करूं. मुझसे नहीं हो रहा है तो मैं प्रोफेशनल हेल्प लूं, क्योंकि ये अनहेल्पफुल थॉट्स मुझे ट्रीटमेंट प्रोसेस में आगे नहीं जाने देंगे प्रॉपर्ली. मैं अगर वर्क पोटेंशियल मेरा यहाँ है तो वो यहाँ रहेगा. मेरे रिलेशनशिप्स का क्वालिटी अगर बेटर हो सकता है तो वो बेटर नहीं हो पाएगा बिकॉज ऑफ दीज अनहेल्पफुल थॉट्स. नाउ व्हेन वी टीच डिस्ट्रैक्शन टेक्निक्स, we tell the clients that think and discuss pleasurable events of your life. So I had seen this patient, एक पेशेंट थे जिनको मैंने एक बार आईसीयू में देखा था. वो आइसोलेशन आईसीयू में थे, आज से 3-4 साल पहले की बात है. तो उनको कुछ इन्फेक्शियस डिजीज था, कुछ था जो यहाँ तक he was not able to he had infection till here, so he was on ventilator for a very long period. Now the doctor told me, there was a neurologist who was seeing him, so he said to me कि उनका वेंटिलेटर हम जैसे ही हटाते हैं उनको ब्रेथलेसनेस होने लग जाता है. और हमें ये पता, हमें ऐसा लगता है पिछले 2-3 महीने से वो वेंटिलेटर पर हैं कि वो सरवाइव कर सकते हैं बिना वेंटिलेटर के, पर वो कर नहीं पा रहे हैं क्योंकि उनको घबराहट हो जाती है. His son, the patient's son, they were 30 years old and they entered the that place, all safety measures taken. They discussed the nice events of childhood, the beautiful memories that they had with their father. And I actually feel that the focus of that 60-year-old client shifted from the breathing to those pleasurable events. And he was able to breathe normally. And he improved actually. And this was the feedback given to me by the treating team. मुझे ऐसा लगता है कि जब हम कुछ पॉजिटिव चीजें जो हमारी लाइफ में होती हैं, जो हमने पहले कभी करी हैं, हम वो करते हैं तो हमें बेटर पॉजिटिव इमोशंस आते हैं. सेल्फ इंस्ट्रक्शंस देना, खुद को ये कहना काम डाउन, टेक इट इजी, आई ट्राई टू हैंडल, अपने आप को पॉजिटिव सेल्फ स्टेटमेंट्स बोलना. अब पॉजिटिव में मैं ये नहीं कह रही हूँ कि आप झूठ बोले कि मैं बहुत खुश हूँ, ऑब्वियसली, पर आप अपने आप को थोड़े से रियलिस्टिक सेल्फ इंस्ट्रक्शंस दे सकते हैं बाय टेलिंग योरसेल्फ टू काम डाउन, टेक इट इजी, let's move step by steps, it's a process, let me trust my treating team. So I think that really helps in relieving the anxiety. Saying stop, जहाँ पे आपका rumination का cycle, आपका thinking का spiral शुरू होता है, वहाँ पे आप stop करना शुरू करें. Absorbing activities, watching TV, I think all of us understand chanting really helps a lot of people, gardening helps a lot of people, listening to music. So these are certain activities that really help. Now, अब जैसे मैंने आपको भी ये thoughts बताए थे, a lot of people have these thoughts where जहाँ पे उनको लगता है कि वो worthless हैं, वो कुछ ठीक से नहीं कर सकते हैं, उनका लाइफ एंड हो चुका है, जिसमें वो फॉर्च्यून टेलर बन रहे हैं. फॉर्च्यून टेलर शायद वो होता है जो भविष्य बताता है. सो कभी कभी क्या होता है कि हम अपनी भविष्यवाणी खुद करने लग जाते हैं, हम अपने आप को खराब बोलने लगते हैं कि मेरा तो कहीं पे कुछ होगा ही नहीं, सब दोस्त भी चले जाएंगे, कोई मुझे पसंद नहीं करेगा. सो जितना हम ये assumptions में जाते हैं उतना हमारा मन खराब होता है. सो उसके लिए ये स्लाइड बहुत इंपॉर्टेंट है, जिसमें आई रियली वांट दैट ऑल ऑफ अस शुड ट्राई टू चैलेंज आवर थॉट्स. वी शुड नेवर एक्सेप्ट, हमें हमारे थॉट्स को एज इट इज एक्सेप्ट नहीं करना चाहिए, उनको थोड़ा सा चैलेंज करना चाहिए. दैट व्हाट इज द एविडेंस दैट आई डोंट लुक गुड, व्हाट इज द एविडेंस दैट नोबडी वुड लव मी नाउ, व्हाट वर्स कैन हैपन. सो यूजुअली डायग्नोसिस और वर्स में बड़े सारे स्टेप्स होते हैं, बट यूजुअली लोग डायग्नोसिस सुनते ही वर्स के बारे में सोचने लगते हैं, whereas there are a lot of steps. So I think we should challenge those thoughts. Am I catastrophizing? मैं बहुत ज्यादा तो नहीं उसको बढ़ाकर देख रही हूँ. Am I overestimating the chances of disaster? मैं बहुत ज्यादा तो नहीं सोच रही हूँ कि disaster होना ही होना है. What are the advantages and disadvantages of this way of thinking? इस तरह की सोच का क्या फायदा क्या नुकसान है. मैं अपने आप को ब्लेम तो नहीं कर रही हूँ कुछ ऐसी चीजों के लिए जो मेरी गलती नहीं है. जैसे मैंने एक पेशेंट से डील कर रही थी. मैं उनकी वाइफ को कैंसर हो गया था. जब मैं उनके हस्बैंड का सेशन ले रही थी मैं पेशेंट के हस्बैंड के साथ. तो उनके हस्बैंड बोल रहे थे कि मैंने अपनी वाइफ को कभी केयर नहीं करा इसलिए उसको कैंसर हो गया, उसको मेरी वजह से हो गया. सो ही वाज इनटू सो मच ऑफ गिल्ट दैट आई हैड टू टेक हिज सेशंस बिकॉज अ लॉट ऑफ टाइम्स फैमिली मेंबर्स ब्लेम कि मैंने इनफ नहीं किया. अ लॉट ऑफ टाइम्स क्लाइंट्स ब्लेम देमसेल्व्स कि मैंने पूजा नहीं करी या मैंने उसके साथ गलत कर दिया. सो बहुत बार हम इसी क्यों में जाते हैं कि मुझे क्यों हो गया. दिस क्यों लीड्स टू लॉट ऑफ नेगेटिव इमोशंस एंड इस क्यों का कोई एग्जैक्ट आंसर नहीं है. इस क्यों के जो साइंटिफिक आंसर्स हैं वो आपके डॉक्टर्स आई थिंक बेस्ट है आपको बताने के लिए. Am I assuming I can do nothing to change my situation? Am I concentrating on my weaknesses and forgetting my strengths? Am I jumping to conclusions? So ये कुछ thinking को challenge करने के तरीके हैं जिसमें मैं चाहती हूँ कि आप अपने थॉट्स को लिखें एक साइड में आप ये सवाल लिखें और अपनी थिंकिंग को चैलेंज करें. उसको फैक्ट ना समझें, उसको रियलिटी ना समझें. वो गलत भी हो सकती है. हो सकता है मैं कुछ गलत पर्सपेक्टिव बना रही हूँ और वो गलत पर्सपेक्टिव मुझे नेगेटिव इमोशन दे रहा है जो मेरी एनर्जी खराब कर रहा है मेरा ट्रीटमेंट प्रॉपर तरीके से लेने में. Now obviously now when we talk about the family, there are concerns that the family have because the family sees the patient suffering and family के लिए भी उतना ही वो पूरा पेनफुल प्रोसेस है जिसमें यूजुअली हम ये एनकरेज करते हैं कि फैमिली किसी न्यूट्रल पर्सन के पास जाके अपने इमोशंस को वेंट आउट करे. अब लाइक यू नो किसी को कैंसर हुआ तो उस लेडी ने अपने किसी और फैमिली मेंबर से डिस्कस किया और उन्होंने बोला कि क्योंकि तुमने ये किया ना इसलिए हो गया होगा. So, जब आप एक बायस्ड पर्सन के साथ डिस्कस करते हैं वो आपके माइंड में कुछ बात डाल सकता है जो आप फिर सोच सकते हैं अच्छा उसने बोला था शायद इसलिए ऐसा हो गया. मैंने सच में ये नहीं किया, मुझे ये करना चाहिए था, तब मैंने सोचा था, मैंने किया क्यों नहीं. सो बहुत बार हमें ये भी देखना है कि हम अपनी फीलिंग्स और अपने इमोशंस शेयर किसके साथ कर रहे हैं. वो एक न्यूट्रल पर्सन है या वो पर्सन है जो मुझे और खराब फील करवा सकता है. Acknowledging efforts of each other is really important. Doing certain deep breathing exercises, in simple breathing exercises, we usually tell people to do it because it gives them a lot of courage when it comes to the breathing difficulties. Like काफी लोगों को chest pain रहता है, breathlessness हो जाता है, restlessness होता है. Post COVID, I see a lot of people जिनको health anxiety है. उनको लगता है उनको गैस यहाँ चढ़ गई, यहाँ कुछ हो गया या पेट में कुछ दिक्कत हो गई. So usually we help them understand कि एंजाइटी के सिम्टम्स फिजिकल होते हैं और डीप ब्रीदिंग एक्सरसाइजेस बहुत हेल्प करती हैं. सो यू हैव टू काउंट 5, ब्रीद इन 1 2 3 4 5, होल्ड इट, काउंट 5 1 2 3 4 5, breathe out, count 5 1 2 3 4 5. 10 minutes in the morning, 10 minutes in the evening. Though obviously in such a short duration we can't do much, but I think that I personally feel that there is a emotional impact of cancer before the diagnosis, after the diagnosis, during the treatment, after the treatment. There is fear, apprehension, functional loss, shattered self-esteem, very common. Attention of most of the healthcare providers usually is on physical area, pain. It's mechanical a lot of times. But I usually feel that, you know, what about the psychological pain? It should be taken care, it should be tackled carefully because it's always there, even if all is okay, but all is not okay because emotional pain stays. I feel that, you know, this is one area which really, really needs to be looked into. And I feel that like there are groups of Alcohol Anonymous, and then there are groups where, you know, people who are suffering are together and they talk about how they have gone through and what was their journey, and it really, really helps them to pick up. So with this, I would really like to end, I would at the end I would just say that a really good team is more than the sum of its players. So I think that we need to trust our treating team and our people around us and move ahead. Thank you.
Yeah, thank you, doctor, for this lovely presentation and questions. So you can ask, you can write in chat box. And now Saurabh is there. Saurabh, welcome. And he is a very senior surgical oncologist. And I think a lot of people know him. And over to you, Saurabh. I think he will be saying something interesting, and we are waiting for that.
Thank you, Dr. Waseem. So, Dr. Deepali, hello. You have very clearly summed up the emotional quotient of the disease burden. And definitely, cancer is a very unpredictable disease. So, not only the emotional behavior is unpredictable and the outcome is unpredictable, also as a doctor, I also feel that how to counsel is also, that technique is also very unpredictable. Sometimes we explain everything to the patient, और पेशेंट को लगता है कि अरे इतने साइड इफेक्ट्स आएंगे, ये प्रॉब्लम होगी, और समटाइम्स हम कट शॉर्ट करके समझाते हैं, तो देन द प्रॉब्लम कम्स अप कि they try to find answers from Google and फिर वो गलत रास्ते चले जाते हैं.
I understand.
So the unpredictability is with us also, and most of the time family members will tell us not to disclose everything to the patient. So I really don't know. I understand that this is an individualized decision with every patient, what to tell and what not to tell. Sometimes we also fall short of their expectations in terms of explaining everything. So I was given a task to cheer up the mood by singing a song. So based on this unpredictability of life, I could not find anything else than the Babu Moshai of Anand, and I'll sing a song from that movie, Zindagi Kaisi Hai Paheli. So जिंदगी कैसी है पहेली हाय, कभी तो हंसाए कभी ये रुलाए. जिंदगी कैसी है पहेली हाय, कभी तो हंसाए कभी ये रुलाए. कभी देखो मन नहीं जागे, पीछे पीछे सपनों के भागे. हे कभी देखो मन नहीं जागे, पीछे पीछे सपनों के भागे. एक दिन सपनों का राही चला जाए सपनों से आगे कहाँ. जिंदगी कैसी है पहेली हाय, कभी तो हंसाए कभी ये रुलाए. जिन्होंने सजाए यहाँ मेले, सुख दुख संग संग झेले. जिन्होंने सजाए यहाँ मेले, सुख दुख संग संग झेले. वही चुन कर खामोशी यूं ही चले जाएं अकेले कहाँ. जिंदगी कैसी है पहेली हाय, कभी तो हंसाए कभी ये रुलाए. Thank you very much.
Yeah, thank you.
So,
great. He's a great singer, actually.
इस पहेली का आंसर किसी के पास क्लियर कट नहीं है. I think all of us needs to put in our efforts. Doctors अपनी जगह and professional emotional help अपनी जगह. And I think सबसे ज़्यादा belief in the treatment, as Dr. Deepali rightly said, belief in the treating team, and भगवान और ऊपर वाले का साथ रहे, तो definitely this disease we can conquer. Maybe in near future we'll get more advanced techniques of treatment, medicines. So yes, cancer will also become a lifestyle disease in near future. जैसे डायबिटीज है, डायबिटीज के साथ पेशेंट अपनी जिंदगी निकालता है. सो आई होप कैंसर भी एक दिन डायबिटीज की तरह हो जाएगा, जिससे डर खत्म हो जाए. डॉक्टर वसीम, ओवर टू यू. थैंक यू वेरी मच.
Thank you. Now there is a most exciting session which I have been waiting actually. waiting for like great speakers, I think great orators. Ritika, we know she, if she does not post in pinks and blues, we miss her. Like in the evening, oh, what happened? Is she fine? Why she has not written any quote? And I think Minnie as well. She's a really lovely lady, actually. So I think I will ask like Dr. Shubha to take from here and introduce the speakers.
Now, for our next session, I'd like to ask Harpreet Kaur to say few words. She is a teacher by profession and she's taking treatment from Chandigarh. At present, she's still undergoing radiation, and we know her through the group only. We have never met her in matlab physically, so we know her through this group only. Someone added her, and she's a very lively, cheerful lady, and I will like to invite her and to start the session. Mrs. Harpreet, and also she's a teacher, so happy Teachers Day today.
Oh, thank you so much, Dr. Shubha. Thank you so much. I think teaching is, like we say, the mothers are our first teachers. Hello, everybody. I'm Minnie and Harpreet from Mohali. Not Chandigarh, but yes, Tri-City Mohali. And I basically am a Fauji daughter and a Fauji wife. So I'm undergoing the treatment from the CH Chandimandir, Command Hospital Chandimandir here. And I've gone through my 6 chemos, and at present I'm done with my 5 radiations. There are 5 more to go. So next week I'm going to be free of that also. Thankfully I can speak, but there's a little problem I'm facing in swallowing. So I guess that's just the side effects of the radiation maybe. So, and I can see, as you can all see, I'm getting my lovely hair back. So I always try to look at the sunny side and the brighter side of life, you know. So because jab control nahi hai, to jaise Dr. Deepali, I wish we had more oncos like you and Dr. Waseem and Dr. Saurabh jaise koi gana suna de jab kisi ko milne jao, to aur kya chahiye patient ko. If you just, you know, receive a patient with a smile and just give them, you know, the it's all okay, it's all going to be okay, just and breast cancer, I think it is one of the safest cancer. Safest, you know, lucky ki itne mein tal gayi bala, and we're going to be all fine. I think I would just like to start because I personally did not get any time to brood over or think about it, because there was a wedding in the family, and I remember my nephew's wedding, and 18th, if I remember correctly, 18th February, I just, you know, kind of told my husband, I think we were having a little, you know, banter in the morning. I said, stop fighting with me. I think I can feel something here. He says, chalo fir mammogram karate. We went for mammogram, and there it was, something came up, and 19th was the biopsy in the morning, and, you know, it takes 5 to 6 days for the results. So पहले तो मैं डरी थी biopsy क्या होती है बीमारी, I mean क्या है, I mean, you know, I don't know what is going to be punctured and how they, and I'm very scared of needles, let me tell you all my friends, patients, and I'm one child, my mother narrates the story, I would run from pillar to post from every room टीका avoid करने के लिए. And the same girl is now like blood test के लिए मेरी जान निकलती थी. In fact, screen पे अगर मैं देख लूँ ना, they show doctor scene and the doctor is taking out the syringe, I would go like, oh, I can't see that. But now the same girl, I've made videos on my chemotherapy, the PARI videos, and I could happily, you know, extend my hand. But now I know exactly kahan prick hona hai, kitna wo skin mein jayega, kitna. I know the details and I'm not afraid of it. So, I mean, a girl being so scared of a needle had to go through all this. So I'm like, wow, I've really come a long way. So, I got the biopsy done on 19th, and I remember the general commanding officer of the command hospital, who was a friend to my sister-in-law's husband. I did not know at that point that he's the commanding officer and the head of the hospital. He was just standing there, and he says, so ma'am, we are in for biopsy today. I said, yeah, but make sure that I have to attend the ring ceremony of my nephew today evening, and I'm fine for that. You know, he says, what? This girl is more, you know, she's more interested in the wedding than a treatment. I said, what treatment? I told you I cannot skip this wedding, and I need to be there today for the ring ceremony. So he says, okay, ma'am, वो तो आप पे depend करता है, biopsy तो करने दो. तो फिर वो मुझे biopsy के लिए ले गए, and I'm literally talking to them कि please ensure that I can attend the function. And would you believe it? I was actually, can I be frank enough? I actually planned to wear a suit since we are Punjabis and Sikh. But when that biopsy thing happened, it was pretty okay. It was just some stapling. I felt some 5 tuck, 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 some staples because probably they injected a whatever local anesthesia or something. And I was like, this was cool. I mean, nothing really happened. I was more, stuck on mehendi and stuff. वो कराना है, वो कराना है. ध्यान तो उधर था. So वैसे ही होना चाहिए सबको. Never think about क्या बीमारी हो रही है. So then last minute, I picked up a beautiful sari. I was like, that little apprehension, that's what my worry was. I pata nahi yaar, blouse pen paungi ki nahi? So let me wear a sari. Who knows if I'm not going to wear a blouse after this ever. So then I wore a sari, and evening I was there. There was a painkiller of medicine. I took that. And I was my usual mini masi, the most happening and the loud person there in the wedding. And people were like, really? This girl has had a biopsy? I said, biopsy to hui hai, surgery thodi hui hai. It was just like, it's just nothing. And that's it. And I enjoyed. And actually, those next 5 days went into the wedding things only. So I was so much involved with my cousins and things happening that I think till now, that cancer thing is not really sunk in. It's just like bimari hai, ek procedure, dusra, it's something or the other just kept coming, So 22nd was the wedding, also happened to be our 23rd anniversary. And that is the day my husband broke the news. It's there. Are you okay now? I said, do not disturb me till the wedding. So 23rd onwards, I went for my test. 24th, I was admitted. 25th was my surgery. And वो भी ऐसी, doctor ने बोला, ma'am, mastectomy करें कि lumpectomy करें. I said, देखो, मुझे इतनी jargon नहीं पता है. आप doctor हैं. I'll be under anesthesia. Whatever you deem fit is perfect for me. Go ahead with it. I'm okay. I'll be like behosh. So you can speak to my husband and just go ahead. Let's go ahead with it. Whatever. I trust you, doctor. Whatever. And that was Colonel Puneet Thakkar. He was an excellent surgeon, a very good doctor, because I told him, wow, doctor, like now, I mean, you've saved my nipple also. I mean, it's a lumpectomy. I'm good. I mean, I look good. He says, ma'am, wait, jaldi mat karo, bhi radiation hone do. I said, you've done a good job. I mean, I feel good about myself. That's it. And then the journey started, and that's how the chemo ke pehle, I would be really grateful. It wouldn't be fair if I don't mention my dear and a childhood friend, Gagan. She came to meet me before my chemos from Delhi. And that's how I'm a part of these groups, thanks to Gagan, because she said, do you know there are cancer groups? And there's certain things like, you may be a positive person, but at times you do have some troubles, physical, obstacles that you might need help with people of the similar kind discussing, and maybe the doctors saying, because, Fauji doctors are very to the point, kaam kiya ye wo, utna hamare mein ye sab nahi hota. In fact, I would like to, I don't know, can I use the word counsel? If the Fauji people can also start something like this would be great, to have meetings and seminars.
Can I interrupt you, Harpreet? Like, when
Sure, Dr. Abbas.
So when you started your journey, you were you were diagnosed, and when you went home, what discussion you have with your family?
Okay, nothing. This was the wedding day. I drove my car. I drove my big Innova car, and my husband took my younger daughter, so they were ahead of me. And I think he told my daughter in the mid when we went back, मैंने कहा अब क्या है? He says, okay, sit down now. Enough of wedding हो गया. Now sit down. I need to tell you something. I said, yeah, what? So I said, क्या? Cancer confirm हो गया? क्या? What is the stage? He says, yeah, it's stage 2 advanced. You've got it in your armpits also. There are 3 to 4 lumps there also. I said, okay, great. So are they going to remove the breast? I said, I'll be anesthesia दिया होगा ना. मुझे तो कुछ पता नहीं चलेगा. I don't want to go through any pain. That was my first reaction. So he says, yeah. I said, yeah, the wedding is over. Take me wherever you want and let's go ahead with it.
And how after that next 24, 48 hours, what was in your mind? What was going in your mind?
I think it was still the hangover of the wedding. I'm so sorry. I wish I don't know if I'm a normal person or not. But I really didn't get the time to brood. Hi, cancer, I mean, there was no drama like that. I was just like, okay, chalo, shaadi dekh li, sugar hai. Ab koi sari wala jo, now I want a sari, I want all the dresses that I wanted. And okay, now it's time to wear the surgery dresses and let's do it. So let's go.
No, but I think at corner of your mind,
that it's been
this
detected
must
at
have
an early
troubled you.
stage. I was actually angry at myself. Ki stage 2 bhi kaise hua? And the doctors told, but I was a little confused that me being a science student, I've done BSc, that I saw the little hardness and the nipple inverting. And why didn't I, talk about this earlier? So that I would encourage all my friends and we don't have normal people here attending. We should be very conscious of our body, and jitna jaldi detect ho, I think it'll be easier for the patient and the doctors. That's all was in my mind. I wish I had gone a little earlier, but I guess it's pretty safe enough even now. So, bas that's it. Gagan ko thank you bolungi. Gagan ne Delhi jaake, there was Miss Satwinder Kaur. उन्होंने कहा Max Hospital group, मैंने कहा wow, and I made so many friends. Ritika is like, hats off to you, Ritika. I keep it's a discipline in itself to write an affirmation every day.
Yes.
मतलब मेरे जैसे से मैं सोचती रहती हूँ, होता नहीं है. ये जितना मर्जी करा लो, I can be good at talking, and that's why I'm a teacher. So I learned so much from my affirmations, and Dr. Abbas, I mean, you're a lovely person. You have your smile, Mrs. Batra. I mean, amazing. It's Mrs. Shubha ne jab mujhe contact kiya, I couldn't believe it. What, really? Me going to be speaking? And I mean, just to touch upon, if you guys want to, I'm having a little personal marital problem with my husband too. And probably we're going through that, but probably my parenting, my dad was also in the army. I'm with my parents right now. My younger daughter's here with me. My elder one's in the third year of MBBS in Rajasthan. And she was a little shocked. I didn't tell her because her exams were going. That is what I thought. I said, Abhi, usko nahi batana, uske second prof exams ho rahe. Don't tell her. She'll be I don't want her to get an excuse of scoring less ki mama ko ye ho gaya tha. I said, don't tell her. And she was mighty upset about that. So I said, मैं शायद filmy mom ban rahi thi. Please forgive me about that. But I know these things do disturb people in the family. And I think since wedding mein sabko pata chal raha tha, cousins, so they're all with me. Like everybody's like, पहले ही बोलने लग गए थे बिफोर द सर्जरी, तेनू पता है ना ਅਸੀਂ ਸਾਰੇ ਤੇਰੇ ਨਾਲ ਆ, ਤੂੰ ਫਿਰ ਤੋਂ ਤੂੰ ਠੀਕ ਹੋ ਜਾਣਾ ਹੈ, ਤੇਰੇ ਬਸ ਵਾਲ ਹੀ ਜਾਣਗੇ, ਕੁਝ ਨਹੀਂ ਹੋਣਾ, you going to be dancing like this forever. So I think the entire family took it in a very positive way, and I didn't know that, मतलब पता ही नहीं चला कब सर्जरी, कब कीमो भी हो गई, गाते खेलते लोगों से बात भी देखो पा नहीं है. Initially I was told 5 weeks for 5 days. Then I was told 15 days, and now it's just 10. So 5 already gone. Tomorrow, Monday, I start, and Friday, I finish with the next 5, and our radiation is going to be over. And then probably some maintenance वगैरह. So जैसे जैसे step होता है, मैं वैसे वैसे धीरे धीरे, I'm just going, taking each day as it comes. So thank you, Gagan and Satinder, for basically putting me into this group, that I could meet you all wonderful people. And I'm glad if I can just bring a smile on somebody's face. That's okay. That's the whole purpose. I think that's it. Thank you so much.
Thank you, ma'am. Thank you, Mrs. Harpreet.
Thank you, Dr. Shubha. Thank you.
And very nicely spoken, actually. So everyone has their own way to deal with the diagnosis, breast cancer ka diagnosis. So I think just not thinking about it is also a way. And so I like to introduce Ritika. And now she's a very young patient, and she has already diagnosed with cancer twice, and already operated twice, underwent chemo twice, and but still, after having so much of things, she is every day she's writing something on pinks and blues, very motivational, very nicely, and very actually very motivating. So I will like her, Ritika, to talk about it. Ritika, please.
Hello everyone, and first of all, Harpreet, nobody can match your vibes. Then Dr. Shobha came to me, and I came to know that Harpreet speaking with me. I was like, nobody can match your vibes. You are a
No.
I named you the powerhouse of positivity. Basically.
Oh, thank you.
Hello, all the doctors. So when it comes to cancer, I feel I am a bit senior when it comes to treatments, because not once but twice I had fought cancer and been over it. First of all, I was diagnosed with cancer in 2009. उस टाइम पे मेरा एटीट्यूड था, I had a 2.5 years son in front of me, and at that time my attitude was, यार ये मेरे बगैर कैसे मेरा बच्चा जिएगा, he is too young to even he has just started going to school, ये कैसे मेरे साथ कैसे करेगा, मतलब मेरे बगैर how will he survive, it will be very difficult for him. So somehow I came over it, and I fought really strongly and believed that yes, I could do it. And thankful to the doctors and the treatment which was given to me. And in 2013, I gave birth to a baby girl, and everybody was shocked that after breast cancer, pregnancy is somewhat not possible. But I gave birth to a baby girl in 2013. And then in 2020, again, I was diagnosed with a breast cancer. But इस बारी मेरा attitude बिल्कुल अलग था. Again, I had a daughter in front of me, but this time my attitude was कि I have to live for her. मुझे इसके लिए जीना है. मुझे इसको बड़े होते हुए देखना है. I want to go shopping with her. I want to see her going to college. I want to be her, like, मुझे इनके साथ जिंदगी अपनी enjoy करनी है. I want to enjoy every bit of life with my kids, with my husband, and for that I have to stand up back. Obviously, जब पता चलता है यार, एक वो बहुत बड़ा shock of life होता है यार, कैंसर फिर से आ गया. और कुछ भी हल्का सा भी कुछ भी होता था यार, अब ऐसे डर लगता है एकदम से यार, है यार फिर से वापस ना आ जाए, फिर से वापस ना आ जाए. तो I would like to tell each and everybody out here that it is all in our mind. And as Dr. Deepali said, what we think comes into reality. I firmly believe into this, that what we think comes into reality. So please think positive and change your reality. Secondly, in 2020 January last, May मेरी chemo start हुई. And I promised my husband that 1st May we are celebrating our anniversary, and I'll definitely end up my 6 courses of chemo before that. Jabki meri last chemo was scheduled on 9th of May. And believe me, on 30th April, I did my last chemo. I was after Dr. Waseem and after Dr. Siddharth. Jaise bhi 2 din jaldi karo, jaise bhi jaldi karo, but I have to finish my chemos before 1st of May. So I challenged myself. I took the best of diets to make sure that I am finishing all my chemos before time. Yes, एक टैगलाइन मिल जाती है लोगों की तरफ से, हाय बेचारी, हाय बेचारी, हाय नु फिर से हो गया, की देखा ना इसने जिंदगी में. All, I am not at all encouraging those people. I am not taking those people's calls. I am not talking to them, because जो मुझे बेचारी का टैग है मैं उनसे बात करना ही नहीं चाहती. Please, I would like to tell each one of you, अगर आपको कोई कॉल आती भी है, like मुझे कोई कॉल आती है या किसी की तबीयत खराब होती है, please encourage them कि आप इससे निकल आओगे. It is just a phase of time, phase of life, and stop giving those बेचारी tags to anybody for that matter. Prioritize yourself. अपने लिए जीना सीखो. पहले मैं, अगर मैं healthy होंगी, मैं ठीक होंगी, तो I would be able to look after my family, my kids better. So, one more thing, I'll just share a small experience that during my chemos, I was bald, and my husband is very comfortable if I'm not carrying a scarf, and I damn care about anybody else after that. So मैं बाहर सब्जी लेने गई, और somehow my father-in-law just stays next to my house. So he came out and he told me, "Ritu, क्या कोई शर्म नहीं रह गई आपको? आप कैसे बाहर आ गए?" And I was like shocked, as if I'm wearing some vulgar clothes, or I'm just trying to show off something that is not required. कि ऐसा क्या था? It is just I'm not wearing a scarf and I've been given that कि आप क्या ऐसे बाहर आ गए हो. तो please start encouraging people. Harpreet ji, I really appreciate the way you put your pictures, and you should. कि यार क्या हो गया, अगर bald है तो बाल चले गए. And see my hair, I have a better quality hair back on my head now. So it is just कि these are things that yes is a part of a treatment, but it will come back. So please don't take it as हाय मेरे बाल चले गए, हाय की होएगा. Please don't take it. And one more thing I'll like to share is, after the treatment, you meet yourself as a new person. you are absolutely a new person. You are, आपकी thoughts change हो जाती है, आपका लोगों को देखने का नजरिया change हो जाता है, अपने आप को देखने का नजरिया change हो जाता है. तो just exercise every day, take the best of diets, and above all, the mental health. Keep yourself as positive as you can. Affirmations, I speak myself to everybody. I have wrote the best affirmations on my mirror, and I speak to the mirror to myself in the mirror every day. The best part is कि आप लिखिए gratitude, see the better things जो आपके साथ हुई, आपको timely पता चल गया कि आप diagnosis हो गया, you are in the best hands of doctors, and you are, आपको best treatment मिल रहा है. Otherwise, I know people who are not financially well, who are not educated enough to even go through the treatments. उनको कुछ नहीं पता हम कहाँ जाएं, कहाँ treatment ले, पैसे नहीं है. So thankful enough कि we are हमें एक बेस्ट टीम ऑफ डॉक्टर्स मिली है, हमें बहुत अच्छे टाइम पे हमारा पता चल गया, डायग्नोस हो गया. अदरवाइज it could have been late, it could have been very late. तो there are many things to be thankful for. तो हम देखने जाए तो हमें बहुत सारी चीजें मिलती हैं, हम जिसके लिए भगवान का शुक्र अदा कर सकते हैं. तो इंस्टेड ऑफ लुकिंग एट कि हाय अब मैं ये नहीं कर पाऊंगी, अब मैं वो नहीं कर पाऊंगी, हमें उन चीजों को अपनी लाइफ में देखना चाहिए जिसके लिए हम थैंकफुल हो सके और आगे. और थैंक यू, भगवान जी हमें थैंक यू करने के रीजंस और देते जाएंगे. That's what I am believing.
Thank you, Ritika. Thank you very much. Would you like to say a few lines also? You write, so can you say 4 lines? You must have written today, sure, है ना?
No, ma'am, not yet. But yes, I had not I've been writing since 1st of Jan. I had not wrote on 2nd of September. Yeah, I was shocked with Siddharth Shukla's death. I was a big fan of him, and I somewhere हमें ना भगवान जी एक इंडिकेशन देते रहते हैं, एक रिमेम्बर वो देते रहते हैं, नोटिस देते रहते हैं कि रिमेम्बर यू हैव टू बी टेकिंग केयर ऑफ योर हेल्थ. मतलब तो एक तरह का वो एक ट्रिगर था. I had posted my hands picture, पीछे lymphedema हो गया था. So I would like to first of all thank this support group and tell people that how effective the support group is. I had got many calls from other people telling me, Ritu, it will be fine, you will do it, we know it will be absolutely fine. So instead of giving that बेचारी, हाय बेचारी, अगर मैं अपनी फैमिली में दिखाती हूँ को ये हाथ तो कहते हैं हाय बेचारी, इतना काम भी कर दी है, बीमार भी रहती है, उसकी बजाय ये कॉल्स आना कि रितु यस यू कैन डू इट, यू विल बी एब्सोल्युटली फाइन, जस्ट एक्सरसाइज, ये एक्सरसाइजेस हैं, ये करो. So this is the difference. What I'm trying to tell is कि instead of giving that bichari tag to anybody, encourage them to fight better.
Thank you.
Yes.
Thank you. I will like to take a few questions which are being posted in the chat box before we say goodbyes. So Mrs. Arvind Kaur has asked a question to the panelists. In order to stop negative thoughts, don't you think counseling of patient and family go side by side? Yes, ma'am. Caregivers and family, friends, they also play a equal important part in the psychology of the patient and fighting the disease and everything. So it is for counseling thing, it is never about the patient, it is about everyone. It is about the family also, it is about the caregivers also, always. Because if family is positive, I think the patient, they will be more encouraged to stay positive.
Yeah, regarding this question, I thought some next time we will have webinar on maybe on caregiver burnout.
Caregivers, yes.
Question. See, somebody I had yesterday seen a patient. She had underwent 3 times kidney transplant. Now, I have never heard of somebody doing 3 times. And look at the burden to the caregiver, the husband who has been like managing all this, and very brave one. And now 4th time she's having cancer. And he was telling, 3 बार कर दिया, इस बार भी will manage it. And very brave person actually. So I think next topic we can think of like caregiver burnout and discuss and talk to the relatives or husbands. If somebody can suppose anybody's name, we can think of that. Yeah, back to you.
And there is one more question. Ki my wife is still suffering from mental pain due to operation 3 months back. Please guide Dr. Deepali. Dr. Deepali, will you like to take this question?
I understand. Obviously, so there must be उनके माइंड में हो सकता है बहुत सारे सवाल आ रहे हों, बहुत सारे क्वेश्चंस आ रहे हों. बहुत बार जैसे मिस हरप्रीत राइटली सेड दैट हम शॉक में ही रहते हैं. जैसे बहुत टाइम तक तो सब कुछ शायद इतना फास्ट होता है कि अब वो और बढ़ ना जाए, कि जैसे ही आप रूम में पूछते हैं पूरा देयर इज अ प्रोसेस ऑफ इन्वेस्टिगेशंस एंड द ट्रीटमेंट एंड देन इन्वेस्टिगेशन, दैट आपको शायद बहुत रुक कर अपने साथ रहने का टाइम ही नहीं मिलता. यू डोंट हैव दैट ब्रीदर टाइम कि मैं रुक कर थोड़ा सा खुद के साथ रहूं. सो शायद कभी कभी ये भी होता है कि सब कुछ इतना जल्दी होता है कि होने के बाद हम रुक जाते हैं और हम उस पेन को महसूस करते हैं. सो आई थिंक she can speak to a therapist, or maybe you can take her to her doctor and she can have her questions जो भी उनके माइंड में है. बिकॉज मैं ये भी देखती हूँ कि डॉक्टर्स एक बार जब एक्सप्लेन कर देते हैं तो तब भी पेशेंट के माइंड में और नए क्वेश्चन आते हैं या वो सेम सवाल दोबारा करते हैं. वो रीएश्योरेंस सीकिंग बहुत ज्यादा रहता है कि सब ठीक हो जाएगा ना, आप कर लेंगे ना, आप मुझसे कुछ छुपा तो नहीं देना. आई थिंक दैट keeps bothering. It is so painful. वो रात को शायद नींद भी नहीं आती है, इतने सवाल चल रहे होते हैं. So I think if she goes and talks to somebody, क्योंकि कभी कभी आप अपने पार्टनर से भी शेयर नहीं करते हो, आपको लगता है वो परेशान हो जाएंगे, उनको मैं नहीं बोलती. So कभी कभी I think going to a third person really helps. Also, I would like to add one point here. There is a concept called resilience. Resilience का मतलब है कि मैं आज अगर गिरी हूँ और आज जब मैं उठूंगी तो मैं अब जो उठ रही हूँ अगली बार और गहरा जब गिरूंगी तो उसके लिए प्रिपेयर्ड होके उठी हूँ. जब उस गहरे से उठूंगी तो उससे ज्यादा गहरे के लिए अब मैं प्रिपेयर हो गई हूँ. रेजिलियंस ही बिल्ड हो रहा है जो मिस रितिका के साथ हुआ कि फर्स्ट टाइम जब आपके साथ ऐसा कुछ हुआ तो ऑब्वियसली you don't know what has happened. The second time you are more prepared to deal with the challenges, the process, the pain. So you have become more resilient as a person, and that really helps because आप खुद ही अपने thoughts को reframe कर रहे हैं, आप खुद ही अपने आप को build up कर रहे हैं, आपको पता है ये temporary phase है, ये हमेशा नहीं रहेगा. So you have sink in that whole thought in your mind. So that is what is resilience. And I think अगर हम सब लोग resilience build up करते हैं gradually, we understand कि हमें जो भी कहा जा रहा है वो खुश करने के लिए नहीं कहा जा रहा है. We are told what is a reality. I think that is what would help us to cope up with the whole process, which is again temporary, which will happen and then end, and that's it.
Thank you, Dr. Deepali. If there are no questions, I will like to end this session. So, psychological health is now taking, matlab, everyone is concerned about it. Previously, it was like कि no one was concerned. There was no counseling, there was no therapist. पहले हम लोगों को लगता था just disease. Even doctors, as a doctors also, हम लोग कहते थे just we have to manage the disease. We were never bothered about the mental health of the patient, neither the caregivers, neither anything. So now every cancer center, most of the cancer centers, they have a full-fledged team. They have a therapist also in their teams. There are regular counseling sessions before the treatment, during the treatment. So don't be afraid anytime during the treatment to talk to those therapists, to take counseling, to talk about your mental health, to talk about your any pain which is it is not related to cancer. If you have any negative thoughts, any negative feelings, you are suffering from depression, insomnia during your treatment, before treatment, please don't be afraid. It is not a stigma to talk to a therapist. पहले before everyone used to consider कि हाँ हम लोग अगर we will talk to a therapist so it will be a stigma, everyone will say कि क्या है, मतलब what is this. No, in today's world it is not a stigma. Depression, mental health is taking toll on everyone's health during the treatment also, And it has been proven also कि positive thinking helps to cope up the treatment far better than those negative thoughts. So you are very easily. So I think you should be taking counseling sessions also whenever required. Talk to your doctors, talk to your family, your friends. So with that, I will like to thank Dr. Deepali, Ms. Harpreet, and Ms. Ritika. Anyone else has any questions or any queries, please they can type in the chat box, or they can message those questions in pinks and blues, and I will add Dr. Deepali in the pinks and blues also. And if anyone requires any personal session with her, so they will have their number from the they can have the number from the pinks and blues group, and they can talk to her and take the appointment and meet her. Thank you everyone, thank you very much.
Thank you. Hope to see you next month again for next session.
Thank you, everyone. Thank you.
Thank you so much. Thank you so much, Dr. Shubha, and everybody for organizing this. I would also like to thank my parents and yes, my husband, who's also been part of the journey initially. And it's because of him that thank you all for letting me be part of the group, and especially my parents, my daughters, everybody who's associated. But she calmed me down and she told me, "Arey, to kuch bhi nahi hai. Surgery aapko dikhti hai." The way she told me, surgery, Akriti, if you're listening, surgery aapko dikhti hai, pain feel hota hai, chemo bhi dikhta hai, kuch ja raha hai, radiation to dikhega bhi nahi kya ho raha hai. I was like, really? I mean, that sounds like a, it's like a game. And there it is. And that's it. Thank you so much, everybody. This was so nice. Thank you so much for making me a part of this.
Okay, bye-bye.
Thank you.